This is a short clip about Recovery Star. My name is Mark Travella. I'm a Service Development Manager with South Essex Partnership Mental Health NHS Trust. The Recovery Star, put simply, is a tool. It's a framework to help healthcare professionals work with service users in a much more meaningful way to make sure that all the elements of their health needs are met. The Recovery Star looks like a star. It's a circle with 10 arms coming out of it, 10 domains, all covering different areas around biological, psychological and social needs of someone with mental health problems. So for example, it's got one arm called Managing Mental Health, there's another arm called Relationships, and there's another arm called Hope. So those things look at things like your management of your mental illness, the Managing Mental Health arm, and relationships maybe around some of the things that are going on in somebody's social life, and the issues that can be raised when you've got a mental health problem, and Hope, addressing things like psychological problems that you'll have when you're suffering from a mental health problem. So the Recovery Star, with those 10 arms, those 10 domains, help a care coordinator and a service user work together in a very meaningful way to make sure that all the issues that contribute to someone's mental illness and the pathways that they need to take towards achieving recovery are understood and considered. And recovery is all about achieving your optimum level of performance, essentially. And so it's really helping that service user to understand all the issues that are important to them to make sure that they get the best out of life, having suffered from a mental health problem. So the feedback from service users is that they really like the Recovery Star because it's allowed them to feel that they're being listened to and that all their needs are being sort of understood and respected in a way that haven't been before, and because it just allows for such in-depth work on so many areas of someone's life. So they're feeling that they're really being listened to and taken seriously, and a feeling that they've got a very good chance of working through their issues through a care plan towards a pathway to recovery. Staff are saying that they like it as well because, again, from their perspective, it allows them to have a much more meaningful relationship and understand that person in a much more meaningful way by addressing the areas of the star in much more depth. So yeah, it's all round, everyone's really liking the star.